My name is Cherisse Berry, and I am an associate professor of surgery at the New York University Grossman School of Medicine. I'm also the associate trauma medical director at New York City Health and Hospitals Bellevue Hospital Center. Our manuscript is entitled Disparities in the Transport of Critically Injured Patients to Trauma Centers, an analysis of the National Emergency Medical Services Information System, or NEMSIS. Unintentional injury is the leading cause of death for Americans aged 1 to 44 years. And when patients are critically injured, rapid assessment, scene time stabilization, and transport to verified trauma centers for definitive care are essential in achieving zero preventable deaths. Patient morbidity and mortality decrease when injured patients are transported by EMS directly to verified trauma centers. And while previous studies have demonstrated a marked survival benefit when injured patients are transported to a trauma center versus a non-trauma center, no study to date has evaluated factors that influence the decision to transport injured patients to trauma centers. So we performed a retrospective review of the NEMSIS database from January 1st, 2018 to December 31st, 2019. And we looked at data specific to the National Association of EMS State Officials East region with final transport destination recorded. So patients with an injury and a final acuity designated by EMS as critical or emergent were included. And the key findings are, number one, 44% of critically injured patients are not being transported to trauma centers by EMS. 23% of critically injured patients designated as meeting CDC field triage criteria are not being transported to trauma centers by EMS. 25% of critically injured patients with unstable vital signs are not being transported to trauma centers by EMS. And when you look specifically at women, critically injured women were 19% less likely to be taken to a trauma center compared to critically injured men. And critically injured women with unstable vital signs are 26% less likely to be taken to a trauma center compared to critically injured men with unstable vital signs. So in conclusion, this is the largest study to date demonstrating an association between gender disparities and the transport of critically injured trauma patients to trauma centers, despite the availability of standardized national field triage guidelines. So this is really a call to action in that performance improvement processes should be evaluated that assess EMS compliance with field triage guidelines. We should implement processes to ensure that critically injured patients are transported to verified trauma centers, and implement processes aimed to eliminate sex-based disparities in the transport of critically injured trauma patients to verified trauma centers. Thank you.